Ooh, weed. So controversial, so topical. Oh God. No, not really, because I mean, most of the states at this point have legalized it, so what's the big whoop? Yeah. All right, so, pardon me, I had a little hair in my mouth. I apologize too ahead of time. You might see some schmutz. I got some shit here, little salmon. I'm sorry, and I didn't want to change my shirt. I'm too lazy, so here we are. All right. Weed, marijuana, and MS. So, I'm gonna use my paper, I apologize. Actually, weed, particularly pertaining to neurological type illnesses, weed has kind of got a lot of notice, a lot of recognition. I don't know so much about, I can't know if I will directly say study. That's with a very loose term, very, very loosely based, but it is kind of getting some notice. So, particularly, and you might have seen some of these things floating around. I know things such as like Parkinson's, essential tremors, and of course the most obvious ones, for those of you who may not know, seizures. I actually, not that you totally care, but I wrote my one of my research paper on this at the time because Charlotte's Web, it's a CBD based weed, I guess, I don't know if you say weed, but it's CBD, cannabidiol, and it was hardly researched. It was being really kind of pressed and it was named, the strain Charlotte's Web was named after the little girl who was having, I think, something around the range of like 700 plus seizures a day. I mean, it got to as I understand, I remember watching where the poor little girl, she was only like 2 or 3 and she was losing weight. She wasn't able to even eat because she was almost just what we call in the field, she was in status, like she'd almost just seized nonstop. So it worked very well for her, as I understand. And yeah, but unfortunately, right at the same time when I was submitting my paper and I was looking back at research, I guess that same year, 2014, it might have been in the later part of the year, they seem to have stopped following it. I don't know I'm sorry, I didn't read too far into the details of it, but that's as far as I know. Oh, and disclaimer, based on what we're talking about, don't come at me with your lawyers. I'm just a nurse. I'm not a physician. I'm going to tell everybody out there, go see your physician when talking anything regarding what I'm talking about, because, well, don't sue me. And if you do sue me, I don't have a lot of money. So, yeah, just don't do it. Be smart about this. This is just more like entertainment, a little bit of info. Take it with a grain of salt. Yeah, okay. So that was, like I said, they kind of stopped the studies in 2014. However, they did have medications already out. I actually, as a nurse, I have even given one of these medications that are cannabis based. There are 4 that this article particularly names. The one that they, I guess, still give right now, which I don't know and I could give my 2 cents and my thoughts and opinions on this. I'm just gonna say FDA and Big Pharma. I'm gonna say that and that's it. But Epidiolex, it basically, as I understand what it reads here, it is ultimately Charlotte's Web, but it is now in a pharmaceutical where a specific company it's not, and I'm not talking like your weed distribution, I'm talking about like actual Biogen, Genentech, AstraZeneca or whatever. One of those companies is actually producing this. So it happens to be, which Charlotte's Web was too, it was 99% CBD and 1% THC, approved for little kids to help them with their seizures. And there was another one that was also kind of more of a naturally based medication called nabaximols, and it again derived from oils or whatever of the plant. The other 2, the one that I'm familiar with, that I have given myself, and a lot of other nurses out there might know, is called Marinol. And I remember giving that mainly as an appetite stimulant for cancer patients. So you might obviously know when you've seen movies or TV, there's always sometimes a cancer patient, they're smoking lots of weed. Well, because weed does obviously stimulate your appetite. Hashtag extra large pizza. So we would give that. But those 2, there's Marinol and there's Sesamet. And those particular 2 medications are synthetically derived. So they mimic, but they are not actual, it's not actual like weed itself to say. So The research on all of this is kind of foggy. The main issue is, and those of you, as I'm recording this now, it's November of 2025. They had recently put out something, well, I should say Trump, I guess, had said something along the lines of considering the reclassification. So to kind of explain this, there are 5 what we call schedules of drugs. And 1 is like the most serious, so something like fentanyl would be a Schedule 1, and then down to like Schedule 5. I don't know what Schedule 5 would be. I don't know, like Tylenol? Or is Tylenol even called? I don't know. It's obviously not as harmful. 1 being the worst. Well, Trump, I guess, has been out saying that there's a possibility that they would reclassify marijuana from a Schedule 1 to a Schedule 3. And that, in and of itself, aside from a whole mass of other things, but in terms of the sense of research, would greatly help people to study it more, because being that it is a Schedule 1 now, it creates, unfortunately, some barriers for people to research it and study it. So that kind of sucks. So we do what we can. So with this, and I'll post the article. But with the article that I found, and it was, of course, I was doing some PubMed, and it's kind of weak, and I was doing, I went back to good old MS Society, and there is one article there that at least has some legitimacy to it. So it's kind of hard to find things, but hopefully if we can get the Schedule 3 accomplished, then there'll be a lot more research and more accurate things. So what I learned was they studied about 3,000 people with MS. And those people said, of those people, 31% of them said they use weed. How accurate is that? I beg to ask you. 31% said that they use weed, and of those 31%, there were 80% roughly that use it for spasticity, and then the other half, I guess then, I don't know how they get these numbers, how they do the math, because my math isn't mathing. It said 80% for spasticity and 69% for pain. So I have only maybe mildly, I don't know, I guess I maybe mildly experienced the spasticity with my particular symptoms. I just know my dexterity was really weak, and but the pain was definitely there. So this, had I maybe back in the day, but then I was also a new grad nurse, and I was, we got to follow the rules. And so obviously I didn't partake, but might have been good for that. Normally, so there is, like I said, there's weak research, but of what they did between those 2 specific symptoms for MS, both of them said ultimately, even though we don't know a heck of a lot, in general, it seems to be fine. People seem to react, have good outcomes with it, if you will. Other than that, with spasticity specifically, I guess, and I'm kind of learning here as I go, so the main meds, if a patient is experiencing really, really bad spasticity, then the first prescriptions would probably be, or they'd run you through baclofen, Xanaflex, which also goes as tizanidine, or Botox. Those are the 3 that they might consider first. Then, unfortunately, I imagine, and again, I'm sorry to say, big pharma, they would probably, and by they I say physicians. I don't know, every physician's different, and I don't know, with again, weed being where it's at in its classification, I'm sure there might be some still intimidation there with wanting to openly prescribe it. So they'll probably go through those first, but otherwise, then weed, or probably, a prescription, or maybe they would prescribe like an oil or something, or say, hey, just maybe not direct prescribe, but say, hey, go to the local dispensary, go get yourself a little oil and see how it does for you. That could be a thing. Pain, again, not the greatest of research, but still good outcomes. Obviously, we all know for pain, weed is fairly effective. I mean, whether it directly blocks those pain receptors, it's gonna make you feel real good. So you're not gonna know you got pain anyway, right? Yeah, cool beans. But so it works fairly effective. However, there are a little kind of some disclaimers or little asterisks in that it interferes with those receptors, it helps with the pain receptors, but also interferes with like maybe the meds that you really need. If you're taking anything else, can interfere with that. So the main medications I'm talking about, which this is also very common, and I don't know if I've discussed this in other videos, but depression. I myself, I guess it's very common, and I will probably do a video on this with our mental health, which is why mental health is so important to me. But there is a very common denominator with depression and multiple sclerosis. And as I am myself, and as I understand other people, it's not uncommon for us to all be on antidepressants. I myself, I love my Lexapro, wouldn't be without it. So it's very common again, but the problem is with some of these medications, if you're on anything that's deemed an SSRI, and I will put that, then unfortunately, weed is going to defeat the purpose of taking that medication. So unfortunately, with that, you'd have to decide, am I gonna take the antidepressant or am I gonna take weed? That's right there, that's your kind of, what do I do? As I understand too, I think it said in the research that it can also possibly interfere with if you happen to take any NSAIDs, so, Advil, of course, ibuprofen, those sorts of things. It can interfere with that as well. I haven't quite heard of that, but, I'm not saying either way, pardon me, regardless of that, I would say that your pain, and that directly, your pain's probably, whether you take, I would probably honestly go with the weed, because the weed's gonna be far less side effects than the Advil, where you have risk of bleeding, you have all these other things. So that's just my 2 cents. Don't take my word for it. The only other thing, those things, as I've said aside, are, they said people that have very progressed or their symptoms are very maybe aggressive. So Selma Blair is a perfect example of this, because if you notice, you've heard her interview, and actually I saw another one just now where the sun triggers. It seems she's got a lot of issues kind of in her vocal area. So wherever that lesion is, it correlates to that. Obviously, as we know, the whole joke goes with when you're doing weed, you get the dry mouth. If you have MS related, any sort of difficulty swallowing or difficulty speaking, and you got the dry mouth, well, then that's gonna probably create some more issues. So just something also to be aware of. I'm gonna say one final thing before I cut this off, not to be a pain in the ass nurse or a total, like, you're being a Karen, but truth be told, I would tell you, please do not smoke. There's many other forms of weed to do. I'll say honestly, I personally prefer edibles, but yeah, your lungs, you need your lungs. Your lungs are a good thing to kind of keep healthy. So despite what anybody might tell you, I'll tell you right now, there is no form of good smoking, period. And I'm sure there's a pulmonologist that would back me up on that. There's no such thing as a good form of smoking. Smoke will damage your lungs, period. So if you do partake in weed, I would tell you to go with the edible flow, go with, transdermal if they got patches or something like that. Do with the more not smokeless, the smokeless form. So that's my spiel. Was that a little wordy? Yeah, all right. But anyhow, that's my 2 cents on weed. If you want to know my final conclusion, I'm personally pro-weed. I wouldn't say no, everything in moderation. There, I said my piece. Again, don't come at me with your lawyers. I'm just saying, talk to your doctor first. Always talk to your doctor first. Okay, 2 cents. I'm gonna peace out. Have a great night.